you.
Hi, I'm Cindy Pearson from the National Women's Health Network and Raising Women's Voices for the Healthcare We Need. We're really delighted that the panel issued a set of recommendations that are so broad, that touch on so many different areas of women's health, and we appreciate that understanding that our healthcare isn't met by bikini medicine. That said, it seems like the attention in the last 24 hours has gone back to that bikini medicine and really focused in on contraception and a supposed controversy about contraception. I just wanted to ask is, as you, the scientists and physician researchers, looked at the evidence, did you see anything that made the committee believe there was any controversy on a medical or scientific basis about considering contraception as prevention?
I'm going to start, and then I'm going to ask Dr. Salganikoff to add in as well. Let me say that I already described how we started our process. We looked at what the existing recommendations were. And for 8 of our recommendations, there were existing recommendations. There were some we thought needed clarifications. I mentioned one such as interventions for breastfeeding. There are others that in appendix we even give little footnotes of clarification. But actually, the United States Preventive Services Task Force does not have active recommendations for either the well women visits or for the contraception family planning aspect. It's not that they never did for the latter. So in 1996, USPSTF did come up with grade B recommendations for counseling, for family planning. Had those recommendations been in effect, but they, by virtue of that process, sunset after 5 years if they're not updated, that would have already been included in the floor of that long list of covered services. So we started with an appreciation that there was already evidence for the effectiveness of this, and we certainly reviewed significant evidence since then, and I think it's fair to say that whatever the attention and the headlines say, that if you look at the issue of just providing these services without the barriers of co-payments as first dollar coverage, there is certainly evidence of the effectiveness of contraception in avoiding the condition of unintended pregnancies, which, as I've mentioned, is a significant condition that affects both the mother and the newborn. I will also point out, because this is sometimes lost and this wasn't a direct effect of what we were looking at, that elective abortions in this country are largely driven by unintended pregnancies. So the ability to actually give women and physicians tools to avoid unintended pregnancies also has another consequence of benefit. Oh, sorry, as I said, I went on and on. I didn't leave you much, but you always have something else very helpful to add. Thank you.
You know, we reviewed, we really looked at what is the most effective way to prevent unintended pregnancy. I mean, that was really the goal. And we reviewed this issue like we reviewed every other issue that we recommended, and there were issues that we looked at that we decided were important to recommend and others where the evidence wasn't there. The evidence on the effectiveness of contraceptives in preventing unintended pregnancy is extremely strong. There is a very large body of research that shows that contraceptives work. And so we felt that this was really an important thing to include as in one of our recommendations. It's also strongly recommended by almost every major medical group in the country. It's covered already, not without copay, by most private insurers and most government coverage plans, including Medicaid, TRICARE, the Department of Defense, the Veterans Administration. These are services that are already covered. So from our perspective, we felt that we weighed the evidence and we made that recommendation based on the evidence.
Thank you. I think it's a useful addition, and again, I'd like to emphasize again, because some misinterpretation in the headlines of free this or free that, we were charged with looking for what works, independent of cost, and what works sufficiently to recommend this first dollar coverage. But it's not that the recommendation would mean, if HHS accepts it, that all of a sudden the insurance companies are not paying for the service they already do. The only difference would be, if it's accepted, is that they're paying the gap in what is often a co-payment or other issue. Dr. Johnson.
Dr. Paula Johnson. I just wanted to add one thing, which was that there different contraceptives can have adverse effects on certain populations of women. And that's the other reason why we felt very strongly that it was important to include in the recommendations the full set of FDA-approved contraceptives.
All righty.